I'm very grateful. Actually, we are very grateful to Naina and Ayushi and Wall Baby Chakra team for providing such a wonderful platform, which is helping mother as well as doctor both. So, health education and health awareness both are a part of the new modern healthy lifestyles, and this platform is providing both health education as well as health awareness. Today's topic is cough and cold. It's a frequent cough and cold. Nana has asked me that, sir, you can do live session for us. Uh, which topic will you pick up? I said in live session there is no need of topic, but she said no. We usually do one topic. So I kept it as a frequent cough or cold because in the OPD we are seeing the frequent complaint of mother that their child is getting the frequent cough and cold. Okay, so what is cough and what is cold and why it can happen as a frequent. Okay, so cough is a normal response to abnormal stimulus. It's actually a protective mechanism of body. Cough is not a disease, it's a protective mechanism of body. So our respiratory system has a many protective mechanism, like we are having the nasal hairs, so that nasal hairs are preventing the inhalation from the large dust particles. So like that cough is preventing us from the abnormal stimulus of the airway. Cough receptors are mainly present in the airway. So whenever there is a predominant cough, there is a less chance of pneumonia. When there is a cough are less and respiratory symptoms are more, then there is a chance of pneumonia. So cough is a predominantly a airway disease. What is a cold? Cold is can be in the form of nasal stuffiness, nasal blockage, or runny nose or sneezing. And this cough and cold are frequently happening, are very easily captured by the less than 6 months of kids. While less than 6 months of kids are easily picked up by this infectious disease of respiratory airways because their immune systems are not developed. Their local immune systems are not developed yet. Their respiratory development is not complete yet. They are in the development phase. And that frequent cough and cold we can see up to 6 year of age. There is a common question from mother that how can it be a frequent, मतलब कितना frequent हो सकता है मेरे बच्चे को. So it could be a 6 to 8 times per year, and it's a huge till 6 year of life. After 6 year we usually see a very less frequent cough and cold. In USA, there was a one study which was showing that there in the USA there was a 2.2 million absent day of the kids in the school due to cough and cold, and there was a 2 million absent day on job due to cough and cold. So absent day in job is due to parental responsibility toward their kids due to cough and cold. So it's a huge problem. It's a frequent problem, but it's a mostly it is a mild to moderate disease. It is if it is associated with the fever, it is due to mostly a infectious disease, and which are commonly a viral disease. So this viral illness like COVID, but some viral illness can last longer, and mostly 90% viral illness can be resolved within a 2 to 7 days. There is a common question from the mother that how much duration it will take to settle this disease, cough and cold. So if it is an infectious and viral disease, the fever can be come down after third day of sickness, and cough and cold can decrease after third day of sickness, and cough can last up to 7 to 10 days. So when mother come to us, so always they are very panic, but that most important thing is in this is the history of the illness. So we have to segregate this, we have to segregate these diseases in the why it is happening recurrent. So for recurrent issues we need a good history from the mothers. Sometimes mother comes that saying that their child is having the breathing difficulty, their child is having the fever and cough, but that history, when we take the history, something comes out different. So we will learn today Okay, how can we know, okay, what could be the etiology for this frequent cough and cold? So onset, duration, and progression, and associated symptoms and past history. These 5 points require to diagnose that why this cough and cold is happening frequently. So onset, why onset is important. So sometimes there is a sudden onset of cough in the children, sudden onset of cough with breathing difficulty. So without cold, without fever. So what it could be? So it's very common in pediatric age group because foreign body is very common in less than 5 year of age, that due to aspiration of some things inside the mouth, the child develop the frequent sudden onset of cough with sudden respiratory difficulties. So this could be a some foreign body inside the airways. And if cough is a gradual onset with fever, with cold, it could be infectious disease. There are duration is also important because duration gives a clue toward the disease etiology. So if cough is more than 14 days with weight loss, it could be tuberculosis, which is very common in India. uh, and frequent cough without weight loss could be allergic symptoms. So there is a recurrent of cough where more than 14 days lasting up to 3 days, and child is not losing weight, child is absolutely all right, that it could be allergic disorder. We will learn gradually that how we can simplify these issues, how we can diagnose this, and how can we focus for on the prevention as well as the treatment. So there are uh, uh, progression is also important. Is progression is very fast, so it could be any serious illness. If progression is a very slow, it could be a subclinical infections. So in the past history also it is a very important because if past is a recurrent nebulization, there is a history of recurrent nebulization, recurrent cough, then it could be asthma. Normally, uh, uh, this uh, we generally recurrent cough and cold we divide in the infectious illness, allergic illness, asthma, gastric acid reflux, and there are very rare etiology type of diseases which we don't have to worry much. So infectious disease are 6 to 8 times per year is very common. These are in India, January to March, and August to September is very common. It could be mild to moderate. Sometimes it can be a severe, like flu. Influenza can go for the longer durations. I will tell you at what point of time you have to compulsory consult a doctor or any medical facilities in the frequent cough and cold issues. So and in August to September to December also there is a viral uh, uh, So there is a one question from the audience. My 3-year-old suffer from the runny nose very frequently, especially in summer. What can I do about it? So I was just talking about it, that frequent cough generally in Indian scenario there is a frequent cough issues is during the January to March and uh, September to August to November. So in the summer also there are more than 200 viral illnesses for the respiratory infections. Among them, some enteroviruses are common during the summer season, as well as during the summer there are many children are habitual to eat ice creams frequently. They are more habitual of cold drinks. So these are the predisposing factors. If cough during the summer cough is without associated with fever, then it could be some allergic to cold, allergic to chocolates. And if it is associated with the fever, high grade fever for 3 days and runny nose, then it could be some viral illness of which is common during the summer. Audience can post a question in the private chat. We'll take accordingly. So, uh, So there is a one more question. My 6-year-old does not experience cough in the day, but he tend to cough a bit at the night in his sleep. What could be the reason? So during the night, what can happen? So there are some two to three. You should have some two to three differential diagnoses in your mind. First is that during the sleep, due to cold, nasal runny drips. When we sleep, that runny nose goes behind the pharynx. In the pharynx, it stimulates the cough receptors and child cough. So it could be due to a runny nose. So we have to treat runny nose in this scenario. During the night, in the supine posture, some patient is having the issue of gastric acid reflux. So when we are sitting posture and when we are in standing posture, that gastric acid reflux are not that much. So when we do supine, generally in obese patients, so that gastric reflux can occur, which stimulate the pharynx and which can give the sensation of the cough. And there could be a cough in the supine posture, but that supine posture cough can be in the daytime also. Only nighttime cough, which is not associated with the posture, is due to allergic problem. Mostly asthmatic children feels breathlessness and cough after evening time and early morning time. They are very breathless and they are having the worsening of the cough scenario during the evening and during the uh, early morning. Okay. So in asthmatic, how can we that asthma we can there is one more question. How can I treat cold in my 6 month old? So, in the 6 month old, generally we prescribe the less medicine because medicine side effects are much. So, generally, very less medications are approved for the less than 2 year of child. We generally tend to give the nasoclear drops, which are just normal saline drops which prevent the nasal stuffiness and nasal blockage so child can feed themselves. And there is a less sleeping issue, and cough and cold get resolved by them own. If it is an infectious and viral illness and we can suspect the secondary infection, then only we prescribe the antibiotics. Otherwise there is no need of antibiotic. Less than 6 months of child, you have to prevent them from the direct air exposure like from the windows or fan or direct from the AC. So you have to be a protective from that side because they are generally staying inside the rooms. So their scope of infection is from the parents only. So you have to keep the good hygiene around your babies to prevent the infections, and child should be protected from the direct air, any type of direct air. How can I manage mild cough in my 2 year old at home? So, good question. Generally, it's a very frequent question that 2 year old child is getting the frequent cough and cold. So, for the treatment of 2 year old at home, uh, if it is a mild, uh, so you can try a steam inhalation because steam inhalation will open up the sinuses. There are some sinuses around the nose, which are there are space between the two thin bones for the ventilation and for the balancing of our skulls. During the cold, our that drainage compromise and there is a chance of the infection inside the sinuses. So due to steam inhalation, there should be a there will be soothing effect inside the nose, and that drainage will be proper, and there will be less heaviness around the face, so child will feel good. Other thing you can do at the home is that for 2 year old child, give warm water soothe the airways, so that due to soothness that cough will decreases. Other thing is that lozenges are very risky for the 2 year of age because they can aspirate it. So uh, rather than giving the lozenges, you can give some menthol preparation of cough remedies because menthol also soothe the throat and there is a less cough there is a less cough in the babies. So other things are common question from the parents are that ki how can they give steam inhalation to 2 year old baby? That's very difficult to give. So basically you don't have to worry about that. Choose the small space inside the room. It could be it could be your washroom. Just create the steam inside the washroom. Keep your baby with you inside the washroom for few minutes till baby get discomfort, then come out of the washroom for few minutes, then again you can steam, you can inhale the steam inside the washroom, then again come out of the washroom. So it that way you can do steam inhalations. Other thing is that there are the many cough suppressants available in the markets. uh, these are the cough suppressant which works on the and there are some mucolytics as well. If there is there is a wet cough, then we have to give the expectorant. If there is a dry cough, if there is a dry cough, you have to use their cough suppressant. So there are various cough suppressant available in the market. You can use antihistaminic drops. Sometimes there is a cold only and there is no cough, and that cold is not responding to any medicines, so that time you need some xylometazoline drops. And if does not respond, which you can't use more than 7 days, because after 7 days there could be a rebound runny nose again. So you can use that antihistaminic for runny nose. You have to consult if if runny nose is lasting longer than 7 days or 10 days on the treatment, it is not responding. You have to consult the medical facilities. There are some steroid drops available to stop this runny frequent longer time of runny nose in the babies. These are the remedies which are available. If there is a sign and symptoms, if fever is persisting more than 3 days, you have to consult the doctor. if there is a subcostal retractions, if there is a खड्डे पड़ते हैं छाती में, बहुत ज़्यादा तेज हवा चलती है, वहाँ पे नोइजी ब्रीथिंग हो रही है, बच्चा सुस्त हो रहा है बहुत ज़्यादा, बच्चे का दौरा पड़ रहा है. देर आर सम वायरल इलनेसेस विच कॉज द फेब्राइल सीजर ड्यूरिंग दिस ईयर. Which between the 6 month to 5 year, there are some viral illnesses of cough and cold which present as a cough and cold in initial days, and later on the second third days, baby throws the seizure. So if these are the scenarios, you have to consult the medical facilities immediately. Other thing is that uh, there is a one more question. What are the things that I should avoid when my kids get a cough and colds? So we are talking about cough and cold here only, and that is a recurrent, and that is without fever. So we have to first assume that it could be allergic. So which are the most common allergies right now in the Indian babies? So most common allergies are the milk allergies, peanut allergies, uh, egg allergies, fish allergies. These are the some common allergies. There are allergies of chocolates. There was there are total 7 kids um, uh, who are treated as asthma, and we have stopped the chocolate from their diet, and they beautifully responded that they didn't require the asthma therapy for longer time. And so chocolate is also one of the cause for the allergic cough and asthma. And history of tobacco, there are the histories of parents are smoking inside the home, that's also predisposing the cough. So you should prevent that allergy response. You should know your babies that after what type of some babies are having the curd allergies. After curd they throws the cough. Some babies are having the citrus fruit allergy. They throws the frequent the long lasting coughs after the that eating the fruits. So you have to know your baby, and that prevent the allergy, prevent from the dust. Okay. Other things are rest is very during the cough and cold. You have to provide a rest to baby. Don't send them schools, because it's already a stressful condition inside the body. Child is not feeling well, so it will be not a good idea to uh, send them to schools. Other things you can do that is that the plenty of waters. You have to uh, patient have to drink a plenty of water during the febrile illness. during the cough and cold, because your basal metabolic rates are increased, so that uh, there will be a, uh, chances of dehydrations, and water intake will keep your baby in the fresh mood. Okay, so there are some other things are that some right now in the metro cities, parents are using humidifier inside the rooms. So during the cough and cold, keep the warm environment in the room, and use a humidifier, a clean humidifier. Sometimes there are a long use of humidifier get infected, and that throwing the air of infected airs, and that dust and all, which is causing the more allergic symptoms towards the baby. So keep the humidifier clean according to company policies of the humidifier, and use that. So there are we have talked about the danger signs when you have to consult the babies toward your medical facilities. We have talked about the common issues like allergic asthma, gastric acid reflux, and infectious, which are an habitual cough. So there are the etiologies for frequent cough, and there are more than eight, but which are very less frequent in Indian childs. So uh, and we have discussed the treatment part as well by questions from the audience. Thank you, audience, for giving the plenty of questions. Uh, There is a one question not regarding the cough and cold. Baby is not sleeping in night due to neck pain. What will I do? So I would like to know the age of the baby, association of neck pain. Then I can consult. But right now session is for frequent cough and cold. So I'm extremely sorry to asambhav nahi. Okay. Uh, if you have any doubt, you can contact me anytime. Uh, So thank you, Baby Chakra.